would like to thank you for choosing Pomona Valley Hospital Medical Center as your preferred location for your joint replacement surgery. Here at Pomona Valley Hospital, we look forward to guiding you through the process from start to finish, in the goal of providing pre-surgery optimization, surgical care navigation, and post-discharge follow-up to ensure a safe and speedy recovery. The Pomona Valley Hospital Medical Center Joint Program is accredited by the Joint Commission for high-quality, consistent care in its multidisciplinary approach to healing. This course is a virtual presentation of the information provided in our in-person class and can be used as a reference for you or your family through your surgical journey. Let's begin. The purpose of the joint replacement class and the program is to improve your surgery outcome. With the help of a designated coach and our multidisciplinary care team, we are dedicated to your recovery every step of the way. So who is your coach? Your coach is the person that is helping you after surgery. This could be a family member or a friend who can assist you during your recovery. This person should also view this virtual class to gain an understanding of what your surgical journey will entail. What is total hip replacement? It's really looking at the diseased joint, removing that portion of the bone and replacing it with another material, plastic, metal, or a combination of both, to improve mobility and movement. This is an example of x-rays before and after joint replacement. Preparing for surgery. You can think of this like preparing for a strenuous race or a hike. What should you do before, during, and after to prepare for a successful day? Our goal is for you to return home with your coach either the same day as your surgery or the next day. This is where your coach can really help. Your coach can make sure your prescriptions are picked up before your surgery, drive you to your appointments, help clear any clutter around the house to avoid any fall hazards, prepare meals, but most of all, be your biggest cheerleader. Discharge planning begins at your surgeon's office. Depending on what your surgeon feels is appropriate for your surgical case, will determine what durable medical equipment is ordered. Examples of durable medical equipment are front wheel walkers and commodes for the restroom. These require physician orders to be obtained from your insurance and should be addressed before the day of surgery. It is a requirement for safe discharge from the hospital because we want to make sure you are safe going home and feel comfortable using your walker. Preparing your home for surgery begins before the day of your surgery. Removing clutter, planning for meals, and making arrangements for childcare or pet care can help reduce the chance of falling or even infection on your surgical site. Ask your coach for help and keep in mind this is temporary but part of a successful recovery. Recovery is different for each person, but plan to be out of work for 6 to 8 weeks. Let's go over a few checkpoints that will help you to move towards your surgery date. 1, you are already participating in the joint replacement preparation class. 2, you will need to obtain medical clearance from your primary care physician and any specialist you see, like your cardiologist. 3, your surgeon may also want a dental clearance from your dentist if there is any concern for infection. In preparing for your surgery, you, your primary care physician, our nurse practitioner, and your surgeon will address certain indicators that may impede a healthy recovery. Stop smoking 4 weeks before surgery. Smoking increases your risk for infection and blood clots. Maintain a healthy weight and diet. Both of these will help with recovery and healing of the surgical site and reduce the chances of infection. Even a few pounds of weight can make a big difference. Improve your diet to include good water intake, fruits, vegetables, and fiber daily. Remember, you're preparing for healing. Good nutrition and hydration is critical to good recovery. If you're a diabetic, get your hemoglobin A1C checked and keep it less than 8. Elevated blood sugars can increase the risk for infections and readmissions back to the hospital. Consider these 4 items as goals to optimize surgery readiness and recovery. Goals to keep you moving towards a successful joint replacement. Optimization is the goal during your pre-admission visit. Pre-admission testing is done at our outpatient pavilion located next to the main hospital. Here, any ordered lab work, x-rays, and EKGs will be done in preparation for your joint replacement surgery. This visit will be done approximately 2 weeks before your surgery and will include our ortho nurse practitioner. Plan on bringing all clearances and any questions you may have. Our NP will review your test results, orders, and conduct any assessments that are required. Details regarding discharge will also be reviewed. Our focus is to be a partner with you, and we are committed to your success. Part of our commitment includes performing a COVID test before surgery. You will be scheduled to return to the outpatient pavilion for a PCR test. This is required for surgery, and results will be given to your surgeon. Here at PVHMC, we want to ensure a safe environment for our patients, our visitors, and our staff. Extra care is given to surgical environment, and personal protective equipment is worn by our staff. This commitment is provided throughout every area of your visit. And again, thank you for your understanding. Before surgery, you will need to discuss what medications you should stop before surgery and for how long. Some of these medications include anti-inflammatory medication, also known as NSAIDs, such as Motrin, naproxen, Advil, or aspirin, will need to be stopped 1 week prior to surgery because these medications can cause additional bleeding. Remember that certain herbal medications and vitamins can also increase the risk of bleeding. Blood clot prevention medication. The physician who prescribed your blood clot prevention medication or your surgeon will decide when it is stopped and when it is restarted after surgery. These medications include, but are not limited to, Plavix, Coumadin, Eliquis, and Xarelto. These medications prevent blood clot formation and increase the risk of bleeding. Another group of medications to consider stopping prior to surgery are those used for rheumatoid arthritis. Medications like Plaquenil, Humira, and Enbrel should be stopped temporarily and will need to be discussed with your primary physician, specialist, or your surgeon. Please review this list and keep your medication list updated to ensure that all medications you are currently taking have been reviewed prior to surgery. Let's get ready for the big day. Pack your bags. Even if you're scheduled for same-day surgery, pack any toiletries and loose garments that you can wear home. You will be provided with shorts and shirt especially designed for our joint patients. This can be worn for your first physical therapy session after surgery. Let your surgeon know if you are using a CPAP machine at home for sleep apnea. Bring your machine and supplies as well, regardless of whether you are scheduled for same day or overnight. This will ensure you will get a restful night's sleep. Let's talk about shaving. No shaving below the neckline at least 3 days before surgery. Why is that, you might be asking? Infection prevention is key. Shaving causes breaks in the skin that can be a source of infection. Next is a difficult request. Please keep pets off your bed 5 days before and 5 days after surgery. Why is that? Our furry friends carry germs, and they could accidentally scratch your legs and create a source of infection. Remember, this is temporary, and you can welcome your furry friends back once your surgical site is healed. So on the night before surgery, you should receive a call from a surgery department RN who will provide specific directions on the time and location of your scheduled surgery. Surgery may be performed at the main hospital or the outpatient pavilion. The nurse will also review medications you can take on the day of surgery and will remind you about the chlorhexidine soap that you will need to use in your shower the night before and the day of surgery. This special soap is provided to you during your pre-admission visit with instructions. Make sure to scrub the area you're having surgery on a little bit more. Rinse well and pat dry. Do not use any soaps, lotions, and powders on your skin. And now put on some clean pajamas for bed. Repeat this process of showering and applying the chlorhexidine soap as directed on the day of surgery. Remember to not eat any solid food after midnight the night before your surgery. This will help prevent complications during the surgery that may lengthen your stay in the hospital. Do drink 2 cups of any sort of electrolyte drink like Gatorade, Pedialyte, 3 hours before your scheduled surgery time. This helps prevent dehydration and will help with your post-surgical recovery by reducing nausea and vomiting. Arrive at the location of your surgery with your coach at the time given by your surgery RN the day before. Please make sure you have a list of your medications, your walker, if provided, and your insurance information to help facilitate your intake process. Please do not bring any valuables. In the pre-op area, more preparations for surgery will take place. Additional chlorhexidine wipes will be given to you again to wipe down the surgical site, and any clipping of hair will take place. An IV will be started to administer antibiotics and other medications as ordered by your surgeon. In pre-op, the anesthesiologist will examine you and provide information on the type of anesthesia that will be used. This is your opportunity to ask questions. A goal of joint replacement is to utilize spinal anesthesia to reduce recovery time. But remember, it is ultimately up to the anesthesiologist to decide what is best for you. Off you go to the operating room. Surgery usually takes 2 to 3 hours, and the orthopedic surgeon will speak to your coach and family after the surgery to update them on your progress. You will be taken to the PACU, Post-Recovery Care Unit, where specialized nurses will monitor you through your recovery. Your vital signs and surgical sites will be frequently examined, and pain assessment will be done to track your progress. After surgery, you will have a dressing on the site where the surgery occurred, and specific instructions will be given on the care of the site. Depending on the type of surgery, you may have foot pumps or sequential devices placed on your limbs to prevent any blood clots from forming, which could lead to a deep vein thrombosis or pulmonary embolism. Both are considered complications of surgery. Ice therapy will also be utilized. You will go home with instructions on how to continue ice therapy and how to utilize the wraps provided. If you're spending the night in the hospital, you will be taken from recovery to a patient room where you will be asked to walk from the gurney to your hospital bed. The goal is to initiate movement as soon as possible. Your nurse will have you get out of bed for meals, and physical therapy will come 2 times a day to help you walk with the walker and measure how far you can go. If you have stairs at home, stair training can also be provided. Safely moving throughout your home will prevent falls and return visits to the emergency room. Pain management is important for discharge. Managing your pain is vital to your recovery. Using ice frequently and treating your pain appropriately with anti-inflammatory medications, relaxation techniques, and repositioning can help alleviate any breakthrough pain you might be experiencing. Blood clot prevention is key after surgery. The risk of blood clots extends up to 30 days after surgery, and surgical patients are at a much higher risk. But there are ways to prevent blood clots that you can do. Ankle pumps, moving your feet back and forth in bed, and mild exercise will keep your blood circulating. And take your prescribed blood clot prevention medications like aspirin or Lovenox, which will usually be prescribed for 14 to 30 days after surgery. Other medications may also be prescribed by your surgeon, depending on your medical history. Your surgeon will order physical therapy to begin 2 to 3 hours after surgery. The physical therapist will evaluate your ability to stand and walk with a walker in preparation for your return home. Between physical therapy sessions, you can begin performing ankle pumps and sitting at the side of the bed to prevent blood clot formation and improve your recovery. If the surgeon feels it's appropriate, occupational therapy will also be ordered, and it will begin on the day of surgery. After surgery, your leg can feel heavy. This is normal. Your muscles can be weak after surgery, but movement and exercise will help. Your operated limb may feel longer. This sensation will resolve after a month or so. Tightness. This is due to the swelling that happens after surgery. Use ice frequently as instructed and elevate the operated leg to reduce swelling. The tightness and swelling last for several months after surgery. Make it a point to perform ankle pumps to increase circulation. Warm sensations and numbness will improve over time and as healing continues. The warm sensation is normal, especially after exercise. Bruising on the operated leg may last up to 8 weeks, especially if you're being prescribed medication to prevent blood clot formation. And any clicking or noise in the joint is normal and usually resolves over time. Be patient with your recovery, but be motivated to keep moving. The lifespan of your joint is impossible to predict. Everyone is unique, and materials used for joint replacement are improving all the time. There are certain factors that can affect the outcome: your age, your weight, your activity level, and bone strength. Stay healthy and moving to improve your joint success. Recovery is individualized for every patient, but significant functional improvement are seen within the first 3 months, and maximum functional improvements are seen between 6 to 12 months. Begin preparing for surgery now. Simple exercises can be done at home 3 to 4 times a day to optimize your recovery. Ankle pumps are a simple exercise that can be done before surgery and after to keep circulation moving and reduce the risk of blood clot formation. They replicate walking. Glute squeezes and quad sets can be done while lying in bed. Simply squeezing your buttocks where your gluteal muscles are located can improve your ability to stand and lift yourself up. Quad sets utilize the large quadricep muscles located in front of your legs. Both glute squeezes and quad sets should be done 10 times per set for 3 to 4 sets per day. Bicep and tricep curls strengthen your arms and allow a smooth transition from sitting to standing and help you maintain your balance when using your walker. There are 2 possible approaches for your hip surgery: posterior lateral from the back or anterior from the front. After your anterior hip joint replacement surgery, there is one precaution we would like you to adhere to. Avoid extending your leg behind you while in bed or while standing. Those strengthening exercises you were doing before surgery will continue after surgery. They will be difficult, but you can do it. Adhere to weight bearing on the operated leg as directed by the surgeon, and do not stand, bend, and twist at the same time during your recovery. Please also avoid using ladders, step stools, or kneeling, as these movements can jeopardize your joint recovery. A few limitations after surgery while you recover. Remember, no strenuous exercises. Start slow and increase as you improve. Sports activities like running, skiing, or contact sports can be too excessive initially after surgery. Ask your surgeon when you can return to those types of activities. Let's review the basics to safely take care of yourself after surgery. Blood clot prevention. Take your blood clot prevention medication as prescribed by your surgeon, and remember to move your legs to improve circulation. Movement is our main form of prevention. Remember to resume your home medications as prescribed by your primary care physician or surgeon after surgery. At discharge, your nurse will review this with you as well. Medications prescribed at discharge should be picked up before you go home. This is where your coach can really help. Take your medications as prescribed to improve your recovery. This information is important to remember and review. The following signs and symptoms should be brought to your surgeon's attention immediately. Any incision changes like drainage or opening you are noticing at the surgical incision site. Any fever you're experiencing over 101 degrees Fahrenheit with chills, shaking, or sweating. Any new onset of severe pain with weight bearing on the operated leg. Swelling in the operated leg that does not improve with ice or elevation. If you should experience any shortness of breath, chest pain, coughing up blood, or unexplained anxiety, call 911 and be transported to the nearest emergency department. Let the paramedic and staff know that you had a recent joint replacement surgery and what medications you are currently taking. Taking care of the surgical site begins with good hand washing. If your surgeon uses staples, please leave the site covered. You may shower, but keep that dressing clean, dry, and intact. Do your best not to wet the dressing. If ordered by your surgeon, a home health nurse or physical therapist will change the dressing at the 7-day marker. You will see your surgeon 14 days after surgery for staple removal and follow-up. If your surgeon uses sutures and glue to close the surgical incision, you may remove the dressing when instructed by the surgeon and shower as instructed. It is important to pad dry the incision site after showering and to not scrub or pick at the incision or glue. Avoid taking baths, swimming pools, or sitting in hot tubs. Please do not use lotions or creams on the incision site until it is fully healed. We will review some precautions and safety measures for anterior hip replacement. Do not extend your leg behind you while lying in bed or walking. Change positions frequently in bed to avoid blood clot formations. Get up out of bed or from a chair slowly to avoid falling or tripping. Make sure to drink plenty of water and eat a variety of foods to avoid constipation while taking opioid pain medications. Your commitment to healing and recovery is a lifelong process. Exercise and stretching before surgery and after will optimize your movement and mobility afterwards. You and your coach can make sure you begin exercising at home and have the necessary equipment to aid in your recovery. 2 weeks after your surgery, you will follow up with your surgeon. Your surgeon will check your surgical incision and see how you're progressing. This appointment is made prior to your surgery, so there is no delay in your follow-up. Your primary care physician and any specialist will also like to see you after surgery to resume certain medications and to ensure that you're recovering well. There is a joint replacement guidebook link on the Pomona Valley Hospital Medical Center website that can be downloaded or printed for you or your coach to review It covers key points for your reference. Here are a few important phone numbers that you can call if you have any questions before or after your surgery. Feel free to reach out to your clinical quality coordinator with any questions. Stay active. It creates balance, strength, flexibility, and endurance to reduce falls. Keep exercising and eating well. This will allow for a strong bond between your bones and your new implant. Remember, take your time. Thank you for taking the Joint Replacement Preparation course provided by Pomona Valley Hospital Medical Center Orthopedic Services. We will be here throughout your journey in regaining movement and mobility.